Welcome to ProtectYourBrain.com. Today, we're going to discuss a memory screen. I'm William A. Van Horn, MD, a medical doctor who specializes in Alzheimer's disease. The purpose of this memory screen is not to prove or disprove if you have early Alzheimer's disease. The test I'm going to show you is called a Mini Cog. This Mini Cog was shown to be 90% sensitive and 90% specific for Alzheimer's disease. What does that mean? Sensitive, it picks up 90% cases of early Alzheimer's disease or advanced, and specific, it's specific to Alzheimer's disease about 90% of the time. Now, I'm going to say up front that if your test is positive, it does not mean you have Alzheimer's disease. At the same time, if your test is negative, it does not mean you don't have Alzheimer's disease. So you might be asking, well, if it doesn't mean anything, why do the test? Well, it does mean this. It means that you need to understand, you need to go see a specialist. One of the biggest problems right now with Alzheimer's disease is the failure of doctors to screen for it and families to seek help and seek an evaluation to see if they're losing their memory. We're all losing our memories. That happens to everyone. And the older you get, the higher your risk that you've lost some memory. So in doing this screen, if you get a positive screen, make sure you see a specialist to find out if you really do have early Alzheimer's disease. And as I say often, is that the treatments we have work on living cells. So therefore, the earlier you start the treatments, the more profound the benefits. Now, how can you screen a family member for Alzheimer's disease? I'm going to take you through exactly what I do in my office. It's a very simple test called the Mini Cog. First of all, what I do is I give them 3 words to remember. The 3 words I use are California, red, and bicycle. They can be any 3 words that you want. And then I ask them to repeat the 3 words to me, and then I say to them, now try to remember those 3 words. The next thing is, I ask them how to spell world backwards, the word world. I let them do that. If they can't do that, then we move on to the next thing, and that is I ask them to do what's called a digit span. A digit span is I give them 5 numbers, and I ask them to repeat the 5 numbers to me forward and backwards. The purpose of having them spell world backwards and do the digit span is simply to distract them, have them thinking about something else for approximately 1 minute. So sometimes when someone really struggles with the word world backwards, it takes them a minute. I move right on to asking them to repeat the 3 words. On the other hand, if someone spells world backwards really quickly and gives me the digit span really quickly and it hasn't been a minute, I ask them some other arbitrary question just to distract them, make sure I get a full minute of them thinking about something else. Then I ask them to tell me what the 3 words are. Now, when I ask them to tell me about the 3 words, if they get all 3 of the words, statistically, they have less than a 10% chance of having early Alzheimer's. What if they get 2 out of the 3 words? Or 1 out of the 3 words? Then what I have them do is draw a clock. I give them a paper with a circle on it, and I say, put the hours of the clock into this picture. And then I look at the picture. Now, what the numbers show is, if a person gets 2 out of 3 of the words, and their clock is abnormal, they then fall into that 90% risk. If a person gets 1 out of 3 of the words, just by itself, they fall into that risk of 90%. Or if they get 0 out of the 3, they fall into that risk. So I'll say it again. 3 out of 3, risk is less than 10% statistically. 2 out of 3 and an abnormal clock, 90%. 2 out of 3 and a normal clock, less than 10%. 1 out of 3 or 0 out of 3 of the words, you're in the 90% range. Now what I'm going to do is I'm going to walk you through the test just like I'm giving it to you. Hi, John. I'm Dr. Van Horn. I want to do a simple test. I'm going to give you 3 words to remember: California, red, bicycle. Now, could you repeat those to me? Thank you, John. Now, try to remember those words. Now, can you spell the word world backwards for me? Thank you, John. Let me do another little test. I'm going to give you a digit span. What that means, I'm going to give you 5 numbers. I want you to repeat those numbers to me forward and then backwards. 8, 2, 7, 1, 6. Okay, thank you for forward. Now give them to me backwards. Now, John, could you repeat the 3 words that I gave to you about a minute ago? And that's the test. If he gives me 3 out of 3, I don't move on to the clock. If he gives me 2 out of 3, he draws his clock. If he gives me 1 out of 3, he draws his clock. 0 out of 3, sometimes I don't do the clock then because I know that they have early Alzheimer's. Again, the purpose of this test is to quickly screen people around you, your family members. Understand, at 65 years old, probably as many as 25% of people have early memory loss, early progressive memory loss that is going to move on to disability without treatment. The goal at this stage of the war with Alzheimer's disease is to slow down the progression of memory loss by catching it as early as possible so that you or your family member never get disabled. Thank you for coming to protectyourbrain.com.